These presentations will be recorded. The Q&A, however, will not be recorded, and this allows for ease and comfort of our attendees. You can submit questions to the Q&A box by clicking at the bottom of your screen. We will be answering them live and at the end of the specific presentation. So we'll have a short presentation, allow for some questions and answers, move into another presentation, allow for more questions and answers. The recording and the FAQ will be documented and uploaded to the website if you want to revisit any of the information shared this evening. Just a fun reminder, please do not share personal health information during this webinar. If there are specific questions, concerns that will need to be addressed more in depth, there's several opportunities for you to engage in that space. First is to attend our open house. Here's a plug to attend in person on September 10th. Or you can reach out to your case manager. If you do not know who your case manager is, you can contact our case management care team at 303-858-2222. Those numbers are on the screen. You can also visit our website for key leadership contact information on the website. Next slide. Lovely. So here's our agenda for today. We have a packed session for you. The first is we're going to meet the DP team that we're presenting. Then we will talk about Community First Choice, or CFC. We'll then move into Children with Complex Health Needs waivers. Then we will pause for some questions and answers about Community First Choice and Children with Complex Health Needs. Then we will talk about the supports intensity scale. We'll do the SIS, we'll do SIS question and answers, and then if we have time at the very end, we'll allow space for general questions and answers that you may have. And we can go to the next slide, and I will hand it off to Michelle.
I think, Kim, you're doing an intro for folks, and then it kicks me.
Yep, sorry.
Yeah, no worries.
Apologies there. I clicked the slide too soon. Here is who is joining me from the DP team today. We have Michelle Baumann, our Chief Program Officer, Nikki Polhemus, Director of Case Management, Alyssa Pei, Director of Case Management, Kristen Yoder, Senior Director of Program Operation, Paige Repo, Associate Director of Systems Navigation, and Sarah Jacobson, Director of Program Quality. All the presenters will introduce themselves with their visual description as they present. And now I will hand it off to Michelle.
Thank you, Kim, so much. We can go to the next slide. Thank you. Hi, everyone. As Kim said, so I'm Michelle Baumann. My physical description is that I have brown hair and wear glasses, and I'm wearing a black and white top. As Kim noted just a minute ago, I'm the Chief Program Officer for Developmental Pathways. At DP, we believe in a full inclusion and participation in community life that is attainable for everyone. So that's really what grounds us. We can move to the next slide. I'm going to go over our DP mission, vision, and guiding principles just real quickly. We're led by our guiding principles at Developmental Pathways, which are integrity, innovation, partnership, and stewardship. Those principles allow us to achieve our vision of enriching lives and strengthening communities, which ultimately leads us to being able to accomplish our agency mission, which is to enrich the lives of people with disabilities and delays by partnering to provide expertise, support, and advocacy in their pursuit of a meaningful life. We can go to the next slide. We're going to now move from all the introductions that you've had to our first topic of Community First Choice, which we'll refer to as CFC for short throughout this presentation. Next slide. One of the things that we really appreciate about CFC is how it embodies innovation, stewardship, and partnership, goals that DP holds close as guiding principles of our own organization. At its core, CFC aims to expand access to attendant services and thus to enrich lives and strengthen the disability community at large. CFC was part of the Affordable Care Act and the Affordable Care and Patient Protection Act, commonly known as ACA. So Colorado has been exploring this option for quite a while. Given fiscal realities and the pandemic, the push to implement and not just explore was started in earnest in 2023. CFC is an optional Medicaid program that allows states to offer select home and community-based attendant services and supports to eligible members on the state plan. This expands these long-term care services to more Health First Colorado members, which is Colorado's Medicaid program, because people will need to meet functional eligibility, but not meet targeting criteria to access these supports. That shift is really critical as it expands accessibility for folks in Colorado. Members will have the option to self-direct some of their attendant care services or to receive services through an agency. CFC gives more members more access to service delivery models that allow them to control their own budget, select and dismiss their attendants, and provide training for the people who provide their care. In case management terms, all self-direction, like in-home support services or IHSS, and consumer-directed attendant services, CDOS, are effectively moving under the CFC benefit. This move provides an enhanced federal match for Colorado of 6%, which helps offset the cost of the supports. This also provides opportunities for innovation in the delivery of supports. In the grand scheme of things, CFC really means more for Coloradans. We can move to the next slide. So you might be saying, so what exactly is CFC? Well, it's a new way of authorizing, delivering, and paying for some services that were previously or mostly only available under Medicaid waivers, including things like personal care and homemaker. These services are not going away. Instead, a list of attendant supports are moving out of the waivers and into a new state plan benefit package. This move changes the oversight and funding authority for these supports. It moves them out of the budget for Medicaid waivers, which is under 1915C, and into the budget for state plan benefits under the 1915K bucket, which we know much of this is so very technical, but those technicalities are really, really important here because that shift means good things for Colorado. It means folks that don't meet targeting criteria for a home and community-based waiver could potentially still qualify for attendant supports under CFC, which is very exciting. Folks do still need to be able to meet institutional level of care, just not targeting criteria. It also expands self-direction under service delivery options, which has been limited to certain waivers and certain supports. So let's lay it out just a little differently. We can go to the next slide. On the screen is a hierarchy of supports, like a pyramid shape, and it shows supports under Medicaid that healthcare policy and financing has started to regularly share with stakeholders. At the very base, at the bottom, is the state plan Medicaid or Health First Colorado. That is, as you know, the basic health insurance program to cover medical costs for people with limited income and resources. Anyone who qualifies financially is in and covered. On the upper levels of this pyramid, you have long-term care Medicaid supports, which include all long-term care programming like nursing homes, home health, private duty nursing, and home and community-based programs like we have in Medicaid waivers, just at the very tippy top of that pyramid. Folks must meet additional criteria to receive long-term care supports, which primarily provides supports to people who have disabilities and/or are aging adults. The different programs have different eligibility criteria, and home and community-based waivers have the most stringent criteria, which includes not only having functional level of care need, but targeting criteria as well. New to this entire pyramid for Colorado is Community First Choice, CFC. This new program moves and/or adds attendant supports to the Medicaid state plan under a new federal authority and allows Coloradans to provide these supports to anyone in regular Medicaid who needs assistance in their homes. It's important to note that this is not just an additional, it doesn't require an additional assessment. Rather, it will be part of the long-term care assessment process. We're going to dive a little bit more into CFC, and I'm going to hand off to Nikki for that.
Thanks, Michelle. Hi, everyone. My name is Nikki Polhamus, and I'm one of the directors of case management at Developmental Pathways. I identify as a female. My pronouns are she, her. I have shoulder length brown hair and I'm wearing a white blouse. So let's talk a little bit more about CFC and how it's the middle space between basic Medicaid supports and full-on home and community-based services waiver level of supports. So it gives folks the option to access a wide variety of attendant support. And I'm sorry, can we go to the next slide, please? Thank you. Okay, it allows.
Nikki, could I just put, never mind.
Yeah, are we good? Okay, thank you. It allows for any and all of those supports to be provided by agencies or self-directed under CDOS or IHSS service delivery options. Effectively, while support definitions are being streamlined into one clear support under CFC, personal care is still going to be personal care services. It will just be authorized outside of the waivers and funded under a different authority. So the services that are moving to the CFC benefit are attendant-based services, homemaker, personal care, health maintenance activities, acquisition, maintenance, and enhancement of skills. This is a new federally required service. Remote supports technology, home delivered meals, transition setup, electronic monitoring, personal emergency response system, and medication reminders. All right, next slide, please. So what to remember about CFC, right? We're throwing a lot of information at you. No one is losing services, but services cannot be duplicated. So they have to be either in an HCBS waiver, that home and community-based waiver, or CFC. People can have both though. You can be enrolled in CFC and an HCBS waiver if needed. Or you could be CFC only, or you could be HCBS only. Services previously just available to individuals through an HCBS waiver will be available to any Medicaid member who meets functional eligibility under CFC. CFC is now available to children and adults. CFC expands self-direction, again, that CDOS and IHSS for certain services. That means you can choose who is providing your services. It could be a family member, it could be a neighbor, someone from your church. You get to self-direct who provides those services. The IHSS is the one that has an agency supporting. There will still be case management supports for members enrolled in CFC. That's us, that's Developmental Pathways, and we're your case management agency. CMAs will provide all case management functions as they currently do for our HCBS Medicaid waiver enrollees. Okay, next slide, please. Let's talk a little bit about timelines. So here we are. It's already past July 1st. That's when CFC was implemented officially on July 1st, 2025. But transition for existing HCBS members who will be moving to CFC services are scheduled to occur whenever their continued stay review or annual reassessment is throughout this next year, with all transitions fully completed by July of 2026. Members are allowed to enroll into CFC sooner than their annual continued stay review if they have a documented change in condition that warrants a new functional needs assessment, which we call the 100.2 assessment. Talk to your case manager if you feel you have a change in condition that warrants a discussion and potentially the need to enroll in CFC sooner. Okay, next slide, please. Another change that has occurred as of 7/1 is the implementation of the Children with Complex Health Needs Waiver, or CWCHN, another acronym. It combines the Children with Life-Limiting Illnesses Waiver and the Children's Habilitative Community-Based Services Waiver into one. Let's dive into this in the next slide. So HCPF is Healthcare Policy and Financing. It's the state authority overseeing the Medicaid waiver programs. And they have received federal approval to merge the Children's Home and Community-Based Services waiver with the Children with Life-Limiting Illness waiver. And they created this new waiver called the Children with Complex Health Waiver Needs waiver, excuse me. The purpose of this waiver is to streamline home and community-based services for children's programs. It also expands access to services and ensures current and future HCBS members have continued access to waiver services. Okay, next slide, please. Okay, so why is this change happening? Why are we merging two waivers into one? So again, the Children's Home and Community-Based waiver currently has two services, the Wellness Education Benefit and In-Home Services and Supports, which is that IHSS Health Maintenance Activities program that we talked about a little bit earlier. As of July 1, the Health Maintenance Activities Service is transitioning to Community First Choice, or CFC. This change would then leave only one service within that waiver, that wellness benefit, and that jeopardizes the state's federal authority to operate this waiver. Without federal authority to operate the waiver, the members receiving these services could be at risk of losing access to this program and other Health First Colorado benefits. So by implementing this new waiver, CWCHN, or Children with Complex Health Needs waiver, this will ensure that the 2,000 children currently enrolled in the Children's Home and Community-Based Waiver, or CHCBS, will continue to have access to their critical services. And then further, it expands existing 1915C waiver benefits on the Children with Life-Limiting Illness waiver to the population of those that were enrolled in CHCBS. Kind of confusing, but in the grand scheme of things, this is again a benefit to our children. Okay, next slide, please. It has, as I was saying, a benefit is it has expanded the eligibility criteria to capture the current CHCBS and CLI populations. To be eligible for this waiver, you must meet the following criteria. Under the age of 19, you meet level of care for a nursing facility or hospital. And meeting level of care means that an individual has a risk of going into a nursing facility or hospital if they cannot receive the services in their home or their community. The member must meet federal Social Security Administration disability definition and/or is a supplemental security income recipient, or SSI. The child's income must be less than 3 times the current maximum Social Security income limit, and their countable resources must be less than $2,000. The only income and resources for the member, only the income and resources for the member are considered. Parent income and resources are not considered part of the child's eligibility. Okay, next slide, please. Okay, so what services are included in this waiver? The services available in this new waiver include all service previously in the CLLI waiver, with the addition of the Wellness Education Benefit, or what we call WEB, W-E-B. These services include counseling and bereavement services, expressive therapy, massage therapy, palliative or supportive care, respite, therapeutic life-limiting illness support, and again, that wellness education benefit, which is essentially a newsletter that gets sent monthly to your home, providing you with lots of good resources and information for you to access. Okay, next slide, please. All right, so let's talk about this timeline for transition for our current CHCBS members. So CHCBS members with their annual renewal dates between July 1, 2025 and June 30th, 2026, your case manager is going to help you transition to CFC because remember, some services are moving, the IHSS is moving to CFC, and then you enroll into CWCHN at the time of your annual renewal plan. Your case manager will be responsible for enrolling you into CFC and CWCHN, explaining these options, explaining the new options, the changes, and what's available to you by going through the service planning process. You'll be able to continue receiving those health maintenance activities through IHSS, which is the main service in the CHCBS waiver. It is just now going to be under CFC instead. I'm sorry, I feel like I'm just speaking like in letters, and I know that's tricky, and we'll have space for questions here in a few minutes. If your parent provides that care, that option will still be available under CFC. So families and parents can still provide those services. For those with a 7/1/2025 planned start date, you've already transitioned. I believe we have double checked and made sure that everyone that was in CHCBS transitioned successfully as of 7/1. For members that have an 8/1 or 9/1 annual renewal or CSR start date, your case manager should be in communication with you and scheduling your meeting so you can discuss these changes. Okay, next slide. For current CLLI members, you were all automatically transitioned to the CWCHN waiver as of July 1st. It was all behind the scenes. All of the databases and information changed over successfully as of July 1. Your services and providers all remain the same with the addition of that wellness education benefit. It's been added to your plan automatically. You will have access to CFC services at the time of your continued stay review, and your case manager will be responsible for enrolling you into CFC, explaining the new options that may be available to you and going through that service planning process. And then again, for those with 8/1 or 9/1 start dates, your case manager should be already in communication with you and scheduling that meeting to discuss the service planning process and these changes with you.
Yes, here I am again, Kristen Yoder. I'm a Senior Director of Program Operations. My pronouns are she, her, hers, and my physical description is that I have long brown hair. I'm wearing red glasses because red is my favorite color, and a black shirt. So happy to be with you here today, and I'm going to take us through. I know that there's been some questions already about the SIS. Thank you for those. And so we'll take you through kind of what the transition from the SIS is, and then happy to answer questions afterwards. But hopefully this presentation, this part of the presentation will answer some of the questions for you. So next slide, please. So to begin, we want to just give a bit of history and context around the SIS. So the SIS assessment was developed in 2004 by the American Association on Intellectual and Developmental Disabilities, or AAIDD. It's been used in the state of Colorado since 2008 for individuals in the Supported Living Services, or SLS waiver, as well as the Developmental Disability, or DD waiver. The Department of Healthcare Policy and Financing, or HCPF, created a rate-setting methodology that reimbursed for services according to a person's need as identified using the Uniform SIS assessment. So individuals who did the SIS assessment were then assigned a support level based on their intensity of support needs identified by the assessment. The SIS assessment was used to establish support levels for day habilitation services or day program, pre-vocational and supported employment services, as well as residential habilitation services in the developmental disabilities waiver. It also used to assign the service plan authorization limits, what we call SPALs, or total amount of funding available for other services in the SLS waiver for a service plan year. Next slide. So a little bit about the decommission process, and we are going to dive more deeply into each of these items listed in the timeline above, but wanted to just show you that the decommission of the SIS and the implementation of the interim support level assessment, what we call ISLA, so another acronym for you, are all part of an ultimate goal and timeline of transitioning to the new Colorado single assessment, which is currently delayed, to provide Colorado case management's ecosystem time to stabilize. So again, we'll go a little bit more deeply into each of these, but just so you can see the timeline as a whole. Next slide. So why was the SIS decommissioned? The decommissioning of the SIS assessment was required because the version of the SIS assessment that was used in Colorado is no longer available as of July 1st, 2025. Legislation was passed at the state level to implement the new Colorado Single Assessment, also referred to as the CSA, which was to replace the current SIS assessment, 100.2 assessment, and service plan. Due to a delay in the CSA rollout, which we'll discuss a little bit more in an upcoming slide, the state needed an interim solution for individuals enrolling into the SLS and DD waivers. With the launch of Community First Choice, CFC, the service plan authorization limits, or SPALs, will be eliminated from the SLS waiver. So just to kind of circle back to what Nikki was saying, I think there was a question around service limits. So there's still going to be service limits within some of the services that moved from the SLS waiver to CFC. However, in CFC, there will no longer be what they call SPALs, right? So there's no longer going to be kind of that annual limit that was previously being used in the SLS waiver for all services. So that's another win. However, without the SIS assessment, HCPF must implement a way to identify an appropriate support level for individuals without an established support level, so for newly enrolling members, for those services mentioned, day and residential habilitation services, supported employment, and pre-vocational services. The support level is an integral factor in setting the rate that providers receive for each individual in specific services. Next slide. So this slide talks about that interim tool, the ISLA. So the Colorado Single Assessment Needs Assessment was designed as a more robust and comprehensive replacement for the SIS assessment. However, as was mentioned in the previous slide, that CSA implementation has been delayed to allow more time for Colorado's case management ecosystem to stabilize. So HCPF has been working with stakeholders to develop an interim support level assessment, or ISLA, to replace the SIS assessment. The ISLA is based on the components of the Colorado Single Assessment, which map across to the SIS support level algorithm. The ISLA needs to be completed for members interested in these services who do not currently have a SIS assessment completed and therefore do not have a support level. HCPF has developed rules to implement the ISLA, which includes a new algorithm for the support level, and they will post the algorithm formula table on their webpage this month in July. Next slide. So the long-term tool, the HCPF in collaboration with stakeholders is continuing. So while using the ISLA assessment in the interim, they're continuing with collaboration with stakeholders to develop a new process for eligibility determinations, needs assessment, and support planning for all individuals seeking or receiving long-term services and supports. The CSA, the Colorado Single Assessment as a whole, will ultimately replace what is now the 100.2 assessment, the ISLA, which was previously the SIS assessment, and the current service plan. The new process is meant to be more person-centered, enhance self-direction, and facilitate greater coordination of services, as well as be equally applicable to adults and children with disabilities. The implementation of the new Colorado Single Assessment has been delayed until further notice. HCPUF is currently forecasting 1 to 2 years to again allow for further continued stabilization of the system before they release it. So the ISLA will be here for a little while. Next slide. So our transition to the ISLA. So Developmental Pathways participated in a statewide work group with HCPUF, family members, providers, and other case management agencies across the state to support HCPUF in the creation and algorithm for the ISLA. We participated in a pilot where individuals with intellectual and developmental disabilities and their families or caregivers were invited to help test the ISLA and confirm the ISLA algorithm. Developmental Pathways had both previous SIS contractors as well as our own case management staff train on completing the ISLA. And we are moving forward 7/1 onward with having contractors and select case managers in our intake and enrollment teams complete ISLAs for newly enrolling individuals into the SLS and DD waivers. Next slide. All right, so this is what you can expect during the transition. So newly enrolling members into the SLS and DD waivers can expect to be contacted by a contractor or case management staff to complete the ISLA within 60 days of the initial 100.2 assessment or level of care assessment being held. The ISLA will take approximately 1 to 2 hours to complete. Members who are already enrolled into the SLS and DD waiver will not experience any change in their current support level. I'm going to just say that again, because I think that's some of the questions that people have. So members already enrolled into the SLS and DD waiver will not experience any change in their current support level. Case managers will still review support levels on an annual basis at the continued stay review to confirm the current support level still meets the need of the member. However, if at any time a member's needs significantly change, a support level review can be requested. The support level review process, which does involve HCPUF, is not changing for the time being.
So these are just some additional resources for you. Again, this information will be shared in the FAQs following up the town hall. There's the phone line. So some resources just about some of these we've actually shared in the chat throughout the presentation, but here they are on this slide as well. And then next slide, please. Perfect. And then contact us, some more information on how to contact us, how to provide some feedback and an information email. Any questions, concerns, additional questions or concerns to be flagged before we sign off? Wonderful. Well, thank you again so much for taking time out of your very busy days. We know this was a lot of information and a lot of changes happening in the system. So please feel free to reach out to your case manager if you have more specific questions. The resources that were provided early on about the CARE case management team, as well as our helpline. Thank you again so much for taking the time tonight and have a wonderful rest of your evening.